Okay, here we go. Let's talk about inflammation and cholesterol, because these are big topics, and this might be useful because I want to give you my opinion on cholesterol. Is it good? Is it bad? Does it matter? Does anyone care? Well, a little bit. You have to learn about this. So do your own research, but here is my take on cholesterol. So there's two main types of cholesterol. Okay, you've got HDL and you've got LDL. High density lipoprotein and low density lipoprotein. So cholesterol is actually a mixture of lipids and protein, fat and protein. That's what makes cholesterol. So they call this HDL cholesterol, high density lipoprotein, is in theory the good cholesterol. It's not quite accurate, but I'll get to that. The LDL is said to be the bad cholesterol. So why do they have these names? Good and bad. Well, cholesterol is a cellular repairer. Cholesterol is essential for life. So every cell of the body needs cholesterol, and cholesterol is made mainly in your liver, on your right-hand side, just below your rib. So good cholesterol they call good because if you have it in excess, it will get deposited back into your liver where it came from. So it doesn't tend to cause any issues. Bad cholesterol is called bad cholesterol because when you have it in excess, it doesn't go back to the liver. It gets deposited into arteries, which potentially can be a problem. And I'll get to that too. So that's the difference between good and bad. And by the way, there's more than two. There's about 14 or 15 different types of cholesterol, but they only really look at two and test two. So, you know, the bad cholesterol, in inverted commas, builds up in arteries when you have it in excess. Now, why would the body do that? The reason it does that is because if you have an inflamed artery, you have a weak artery, right? So cholesterol and calcium are the two cellular repairers. They're the two structural tissues for the body to repair inflammation, because an inflamed tissue is weak tissue, so you have to strengthen it. Cholesterol is like the mortar that holds the bricks of your house up. So why is it bad and why does it go into pipes? Well, okay, think about it like this. This is the analogy that I use in clinic. Your house is on fire. Your house is burning. The firemen have come to the house to put out the fire, right? So the burning house, you've got firemen there. So there's only one logical conclusion you can draw from that. The firemen must have lit the fire. No, that's insane, right? They're at the scene, but they're not the reason that you've got the problem. They're there trying to fix the problem. They're trying to put the fire out. So what is the fire? The fire is inflammation. You'll find them at the scene, but they're not the culprits. So if they're going to line your artery, your blood vessel, and they're going to build up and build up and build up because they have to keep strengthening that artery because it's weak, then the lumen closes. So the lumen is just a fancy word for the passage where the blood runs through. That hole in the artery, that cavity, is called the lumen. So that's basically what you've got going on. If you have a problem with inflammation and your artery is very inflamed and weak, you have no choice, your body has no choice but to line that with cholesterol. So calcium you seem to build up more in joints and tendons, sinews, ligaments, that kind of thing. Calcium, calcification, right? When cholesterol tends to build up more in arteries. That tends to be the problem, but understand that the driver for that is inflammation, right? It's not cholesterol or calcium. That's just your body's ways of repairing it. They're the two main things it has. Now, the other thing that it's important to pay attention to is called triglycerides. What are they? Triglycerides is a glycerol molecule. They're free fatty acids attached to a glycerol molecule. Free fatty acids, triglycerides. So this is how sticky your blood is, how much free fatty acid you've got floating around your blood. So we want that in Australia to be under 2.0. That's important. Different other countries might have a different numbering system, but that's the one that we use in Australia. HDL cholesterol needs to be above. What does it need to be above? It needs to be LDL cholesterol, I think, needs to be about 3.5. Now, for most pathology places, if your bad cholesterol is that high, they're going to totally freak out. So is your general practitioner, your GP. They think that needs to be way lower because, in theory, cholesterol causes cardiovascular disease. And again, if you examine that theory, it's so microscopic, it just vanishes upon investigation. There is no link between cholesterol and cardiovascular disease. There's plenty of link between inflammation and cardiovascular disease, but that's not what you're told. So an inflamed heart is a weak heart, and you will find cholesterol there trying to repair stuff and trying to block stuff up, trying to strengthen things. So that's more important. HDL cholesterol shouldn't really be, it's got to be at a certain level, which is about 2.0. So this can be about 2.0. Your triglycerides you want to be below 2.0. So I'm going to pay a lot more attention to your triglycerides and your blood sugar, because that's going to indicate a lot more. It's going to give you a lot more accurate information. You don't want to be pre-diabetic, right? You don't want to have a lot of triglycerides in your blood because that's how sticky your blood is. Sticky blood leads to clotting. That leads to heart attacks and strokes. That's why that's important. So how do you make your blood sticky? Well, you have a whole lot of refined carbohydrates. You have vegetable oils. You have things that thicken your blood and mess it up. That's how you do it. You're very unlikely, well, you can't do this with healthy fats like olives and avocado and coconut and chia seed and basically nuts and seeds. They're all full of fat, but they're healthy fats and they don't clog you up. They actually reduce inflammation, they don't increase it. So that's important. So HbA1c is probably the other thing to mention. HbA1c, if you read that on a blood test, that's looking basically at your blood sugar, the average of your blood sugar over the last 3 months. So I think that that's more important. So I will always look at your LDL, your HDL and your LDL, but I'm also going to look at your triglycerides and your overall blood sugar. If this is over 2, I'm going to start to freak out a bit. If this is under 3, I'm also going to start to freak out a bit. I want this to be about 3.5. And by the way, women over the age of 50, naturally their cholesterol level rises because cholesterol is needed to make sex hormones. And if you're premenopausal or you're in menopause, your ability to make sex hormones decreases. So the body lifts the cholesterol up to try and bring the balance, because estrogen is what cholesterol is made from. It's one of the really, really key important things, which is also why women have much lower incidence of cardiovascular disease over the age of 50 than men do. Isn't that interesting? Think about that for a minute. So cholesterol is not the enemy that it's been made out to be. What is the enemy is inflammation. Whether you've got vasculitis or you've got calcification or you've got arthritis or you've got any other sort of itis word, inflammation, pharyngitis, sinusitis, gastritis, whatever. The problem is inflammation that's not being controlled. And the driver for that is basically refined sugars and refined carbohydrates and poor quality oils. That all drives inflammation. So I just wanted you to know a little bit about that, but this is the kind of work that I do when I help patients understand their blood tests. It's very important to have accurate information and have a different perspective on what the medical fraternity will tell you, the Western medicine fraternity, because LDL are that high, they're going to try and immediately put you on a statin, which is really not a good idea. Cholesterol is essential for the brain and for the myelin sheath of nerves and for 1,000 million other reasons. So don't fear cholesterol, fear inflammation. I hope that makes some sense. If you've got any comments or questions about that, please leave them in the comments. I just wanted to do a bit extra to keep you going. I'm in reviewing your paperwork, and I will get back to you in the next day or so, 24 to 48 hours. Good luck, and I'll see you next time.